Hi, everyone. Again, my name is Kelly Mann, and I'm the program manager with A Time to Heal. And at this time, I'd like to introduce our executive director, Brenda Helgett.
Thank you so much, Kelly. And as I mentioned earlier, I'm not only executive director of A Time to Heal, I'm also a cancer survivor, just like many of you folks here in the room. Lymphedema is a topic I've always wondered about, wanted to learn more about. So I'm really glad we have Lauren with us today, and it's an honor to introduce her to you. So Lauren Robbins, she's received her doctorate in occupational therapy from Creighton University, and she has her master's in healthcare operations management from Nebraska Methodist College here in Omaha. She specializes in cancer rehab, breast cancer rehab, and the treatment of lymphedema. She has led development of oncology-focused rehab programs in the Omaha area. She's lectured at Creighton University and College of St. Mary, and she's been a certified lymphedema therapist for over 10 years. She also has a private lymphedema management practice right here in Omaha. Lauren, we're so grateful to have your expertise on this important topic, and I know everyone's eager for you to begin, so please take it away.
Well, thank you so much, Brenda, for that introduction, and Kelly for operating and monitoring the chat. I sure appreciate that. I'm so happy and pleased to be asked to present this morning on lymphedema. It's obviously my area of passion. My philosophy with this presentation is to empower my clients. And so we'll talk a lot about what lymphedema is, what the lymphatic system is, excuse me. And as we get into precautions and prevention, having that knowledge base will make a lot of sense and hopefully connect those two pieces. I do have a few who mentioned to also highlight lower extremity lymphedema, so we'll be sure to talk about that as well. Feel free. I want this to be interactive. I want this to really match the information that you all are wanting. So ask those questions in the chat box. Come off of mute if you would like. Just interrupt me. I get nerdy. I get excited about educating individuals. So you will not offend me if you interrupt me. So with that, let's get started. I will share my screen and we'll get going. I have a few fancy motion there. I do include my email there on the opening slide. If you feel more comfortable reaching out to me directly, please feel free. LaurenRobbins2005@yahoo.com. And excuse me, I need to get some water. And we can have a more private discussion if appropriate. So hopefully by the end of this presentation, everyone will be able to define what exactly lymphedema is, talk about signs and symptoms, and talk about how to treat it as well as manage. I like to start off these discussions with a few pieces of data and statistics. So currently there are more than 15.5 million cancer survivors in the US. By 2026, that number is expected to be over 20 million individuals. 1 in 6 people over the age of 65 is a cancer survivor. Survival rates continue to increase. 64% of adults diagnosed today can expect to be alive in 5 years. Breast, prostate, and colorectal cancer survival rates beyond 5 years exceeds 90% now. And then we've all heard 1 in 3 men and 1 in 5 women will be diagnosed with cancer in their lifetime. So what does all of this mean? Why am I bringing this up? Individuals are living longer, either with their disease, with their cancer, such as other chronic conditions, and they're also living with side effects from their cancer and cancer treatments longer. This leads to a focus on survivorship and quality of life. Over my decade plus career in lymphedema, in fact, the focus has continued to increase on survivorship. And one of those very important survivorship and quality of life issues or concerns is lymphedema. So what is the lymphatic system? I like to say the lymphatic system is a sewer system for our body. It filters out the foreign substances, potential infections, and all of the other gunky stuff that our body is exposed to. It's responsible for maintaining our fluid balance in our body, and it has the responsibility of recirculating 3 liters of fluid each day. Well, think about that. 2-liter bottle of pop plus another half, and that's what our lymphatic system is doing day in and day out for us. It truly has a unique structure of lymphatic vessels that allows the absorption of interstitial fluid, molecules, cells, proteins, etc., continuously flow throughout our body. It is essential to human life and plays an integral role in our body's overall health and wellness. It's part of our immune system, yet many are not well educated on its anatomy, physiology, and function. If you go to a lymphedema therapist or a lymphedema specialist, we probably know more about the lymphatic system than a physician. The physicians are learning all of their items. They're, of course, extremely important in our treatment, surgeries, etc. But not so much, they tend to not so much have as much experience and knowledge about the lymphatic system. The lymphatic system is a very complex network of vessels, tissues, and organs, and fluid is absorbed in a one-way valve system that lacks a pump. So your circulatory system uses the heart to pump fluid throughout the body. The lymphatic system relies on our muscles to help pump. And we do that through movement. And then we'll talk a little bit later on how other ways that we can do that. Here's a visual depiction of the lymphatic system. If you look on diagrams and charts, the lymphatic system is usually shown in green. And then you can also see it follows very closely with our circulatory system. They work very closely together. And then we have a few other organs involved in our lymphatic system: the thymus gland, the spleen, tonsils, the liver. Think of all of those organs as additional filtering stations for our body. I could talk for hours just on the anatomy and physiology, so I'll give a brief overview. And again, I do this to help us understand why we treat it in the ways that we do, and then with prevention and precautions.
Lauren.
Yes.
I did have a question that was submitted on the statistics slide. If we could just quick go back to that.
Yeah.
So the question says, I thought cancer likelihood was 1 in 8. Did that increase?
It has changed. Yes. Yes, it is 1 in 5. This was taken from American Cancer Society statistics just in 2020.
Thanks, Lauren.
Yeah. Now, 1 in 8, that could be referencing breast cancer too, which is where I've heard the 1 in 8 is specific to breast cancer. 1 in 5 is all cancers combined.
I'll go ahead and put a link in the chat box with that. I found it on ACS's website, so people can reference that breakdown.
Thank you, Kelly. Appreciate that. Good questions. I love it. Going back into just a little bit of a closer look into our lymphatic system. So our lymphatic system produces these things called lymphocytes, and they are white blood cells, part of our immune system. And their job is to recognize foreign cells, substances, microbes, and even cancer cells. They identify those, they seek them out, they destroy them, and then they help eliminate them from the body. Lymph organs include the nodes, the vessels, thymus gland, spleen, tonsils, and Peyer's patches are in our intestines. Pretty neat, huh? It's a lot more than maybe you wanted to know about your lymphatic system. So how does the lymphatic system work? One way to think about how the lymphatic system transports fluids is what I call the beans analogy. So if you get a bag of dry beans from the grocery store and you soak them overnight as instructed before you're going to cook them, before they're dry, they're hard. The next morning, when they've absorbed the amount of fluid that they're supposed to, they're soft. Now, if you let those beans just continuously sit, what happens? That skin continues to break down, the inside will start to flow out, and it becomes kind of mush, right? So I use that analogy when thinking about our lymphatic system, because our lymphatic system operates in a similar fashion where fluid is constantly flowing in and out of our interstitial space. And what that is, without getting too technical, is under your skin layer, you have this space in between your layers of skin and then where you have your vessels. And that's the interstitial space. So fluid is constantly floating back and forth. We don't even realize this is happening. It happens through processes called microcirculation, diffusion, osmosis, and then various pressures that are put on our body. We do this through our everyday movement, our arterial pressures, our blood pressures. When you're flying, can put a different pressure on your system as well. So keep these things in mind as we move further in the talk. The best way I like to explain how our lymphatic system works is via a highway traffic system. The lymphatic system moves fluid through this highway transport system. Our lymph vessels are the highways. They collect the fluid. And then our lymph nodes are kind of like the toll booths along the highway. They filter out the fluid for us. And then they send it on wherever it's supposed to go. Either back into our circulatory system because we can reuse it, recirculate it, or if it's waste, it is expelled through our urine, eventually through our kidneys and through our urine. When there is damage done to the lymphatic system, either the lymph vessels, those highways, or your lymph nodes, the toll booths, you now have what I call a traffic jam in that area. So for those that have gone through breast cancer treatment and you had lymph nodes removed in your armpit or radiation to your chest and armpit area, you have a traffic jam. Road construction is going on in that armpit area. And for those that have lower extremity issues, in your groin would be your traffic jam. This traffic jam, this road construction, is called lymphedema. And we all know about road construction in our respective areas, I'm sure. We want to try to find an alternate route around that road construction. And that's what my goal as a lymphedema therapist is, to do so and to help your body figure that out. Any questions Kelly or from the group on the anatomy and physiology of the lymphatic system?
We haven't had any questions yet, but if anybody has any questions, you guys can feel free to come off mute if you're comfortable doing so. Otherwise, again, you can submit questions in the chat either to everybody or directly to me as well.
Awesome.
I do have a
Go ahead.
I have a question about you said in the intestine.
Yeah.
What filter? I didn't catch that. What
Yes.
filters in the intestine?
So let me go back to that picture. So we have, they're called Peyer's patches. The individual that found them was Peyer, P-E-Y-E-R. And think of them as little teeny organs in your intestinal area, kind of a filtering station in the
Okay.
intestinal area, working very closely with your circulatory system and your digestive tract. It's amazing how closely all of these systems work together. Our skin system, our circulatory system, the lymphatic system, all of them work very closely together.
Great.
Lauren?
Thank you.
I have a quick question.
Yes.
So we hear a lot about, when we have lymph node removal. I know what my lymph node removal was in my armpit, but I don't know what's the average number of lymph nodes folks have in various areas.
That's a great question. So on this picture, you can kind of see where it says lymph nodes of the axillary region. So on average in our armpits, we have around 15 to 20 lymph nodes total. I've seen as little as 5 to 8 and as high as 32 in my experience. So on average, around 15 to 20. That all depends on male, female, how tall you are, your genetics, etc. You're born with that number of lymph nodes, and they do not grow back. I did have a physician apparently tell someone that they do not grow back. So once they're removed, once they're plucked out of there, they cannot be replaced. And that's why we have lymphedema. So yeah, around that 15 to 20. And then your groin area is generally around the same, but your groin is a little bit different because you have superficial lymph nodes. So those are closer to the surface. And then you have deeper lymph nodes that are much deeper within the groin area. And it ends up being around closer to 20 to 30 on each side. We have lymph node deposits all over our body. Concentration in your head and neck area. You have them all along your vertebrae, your spine. You have a big concentration in your gut area. They're located all throughout.
Thanks, Lauren. We have had a couple questions submitted. So one person asked, does the higher number of lymph nodes removed correlate to a higher risk of developing lymphedema?
That's a good question. I have that one in the slides, so we can wait on that one.
Okay.
It'll be coming up.
Another participant asked, you mentioned removal of nodes and radiation. Does radiation make lymphedema worse?
It tends to, it has a higher chance of making it worse. Not for everyone, I will say that. But if you think about it, it's doing further damage to the lymphatic system. But everyone's bodies are different. Everyone's lymphatic systems are different, and how quickly it can accommodate. How quickly it can relearn how to circulate that fluid elsewhere. So it certainly plays a significant role, yes. And research shows those that have had radiation tend to have a higher chance of developing lymphedema. And that's for upper extremity as well as lower extremity. Good questions. Okay. So lymphedema is defined as a progressive and chronic medical condition that results in swelling in the affected body region. So it's a swelling occurs in that area due to some kind of damage done, an injury or a disruption to the lymphatic system. And then the lymphatic system is not as efficient at collecting and then moving that fluid along like its job is. Kind of like traffic when you have that slowdown, that bottleneck, and the cars aren't moving at their regular efficient speed. I'm a visual person, guys, so I like to use visual aids to help me understand complex concepts. So lymphedema facts, the incidence of lymphedema, it's estimated that it can affect 150 to 200 million people around the world. The number one cause around the world is actually from a parasite, and that's around 90 million individuals. Breast cancer is around 20 million. And then primary lymphedema, so that is congenital, you're born with some kind of disruption in your lymphatic system, is around 2 to 3 million. Lymphedema occurs in about 50 to 70% of women who have had axillary lymph node surgery. Other research suggests anywhere from 7% to 63%. So I don't put this information in here to confuse you, but why I put it in there is because cancer-related lymphedema has been difficult to quantify due to delayed onset of symptoms and a lack of standardized diagnostic criteria. If you talk to a lymphedema therapist versus a physician, they might have different ideas on what encompasses lymphedema. A uniform definition of lymphedema does not exist. Volume displacement methods, so that is when you stick your limb, your arm, or your leg into a huge vat of water. It's considered the gold standard for diagnosis. However, these methods are generally pretty cumbersome and they don't identify the very early onset of lymphedema. So many of you might be more used to the circumferential arm measurements where a lymphedema therapist is measuring around your arm, the girth measurements. If you can, it's ideal to obtain measurements prior to surgery and treatment, and then you have a baseline to go off of. That's something that I was really trying to push our physicians to do, is to get those baseline measurements, and then we can compare. What I tell people is generally around 20 to 30% of persons with breast cancer will develop lymphedema. And then it does range a little bit differently with head and neck areas. And lower extremity tends to be a little bit higher incidence. And if you think about it, that makes sense because we are standing on our legs, we're sitting, so our legs are in going against gravity. So it's a little bit harder for our legs to pump that fluid. There's no pill or diet for lymphedema, and there's no cure for lymphedema. Once you have it, you must manage it for the rest of your life. And we'll get going, and I know there's a few questions related to these things. Just a few terms. You'll sound fancy with your friends and at parties. So ultrafiltration is fluid leaving the arterial side of our capillaries, and there's a picture there to show that. Lymph is fluid collected from that interstitial space that I talked about earlier underneath your skin layers. And that includes those lymphocytes, proteins, water, and fat. Transport capacity. Now, this is one that I like to tell people. This is the amount, the total amount of lymph fluid the lymphatic system can handle. So this is your ceiling for your lymphatic system of what it can handle. And then the lymphatic load is the amount of proteins and fluids that it has to manage every day. So we have a built-in safety valve in our lymphatic system. So when the lymphatic system is functioning well, there's no damage done, there's no disruption, we don't even really notice our lymphatic system. It kind of does its own thing, right? When that lymphatic load starts to creep up and it goes above our capacity, that's when we start having issues. So there's two different types of lymphedema and insufficiencies. One is a dynamic insufficiency. So that's when the lymphatic load exceeds that transport capacity in an intact lymphatic system. So no damage is done to your lymphatic system. So that happens with generalized swelling in a dependent limb. Let's say you sit for a while and you have your foot down and it starts to get tingly, numb, and maybe puffy. It's humid outside and you go for a walk and your hands and fingers get a little puffy. That's that kind of swelling. A mechanical insufficiency is the same thing when the lymphatic load is too much for our capacity in a damaged or compromised lymphatic system. So that is lymphedema. When surgery or radiation has occurred and your body's having trouble handling that lymphatic load. So I explain it like, okay, so I'm pregnant. I get bigger, right? I'm supporting another human life. And my transport capacity is right here. Here's my ceiling. Here's normally where I run. I get pregnant and I gain 20 pounds. And my body says, oh man, that's a lot of extra weight, a lot of extra fluid. So I'm very close to my ceiling, right? And then I have the baby and I go back down to my regular area. So I still have that safety valve. Or someone who has had damage done, including lymph nodes removed, radiation, bam, you are right up against your ceiling. So now you don't have much of that extra safety valve, right? You're running right against that ceiling. So an infection happens, or over time, your lymphatic system gets weakened. You go over your transport capacity, and now you have swelling. Now you have lymphedema. Does that help? I know it's kind of a complex thing, but that's how I think of it. You have that built-in safety valve, but once you have damage done, you're right up against it. You're right up against your ceiling. And again, I like to explain these things in such a way because it makes sense when we get into our precautions and preventions. The stages of lymphedema, stage 0 or latency. So that is what I was talking about. Your ceiling now, you're right up against your ceiling. Your transport capacity is reduced, but you don't have any visible signs of lymphedema. Stage 1 is when you start accumulating that protein-rich swelling. You might have pitting. So when you stick your finger on your arm or your leg, it has a little dent in it, but that swelling can go away. These are the folks that say, yeah, throughout the day, my legs feel really heavy or my arm feels really heavy and sore and tight. But then when I wake up in the morning, it's not there. That's stage 1. Stage 2, you have that swelling, you can have the pitting, but it no longer goes away at nighttime or with elevation. And then stage 3 is the highest stage of lymphedema. That's when you have so much of that protein-rich fluid stuck that it's almost hard. You can have skin changes with this. And then it's also known as elephantiasis. Think about an elephant's leg and how it has that kind of hard, firm look to it. That's what can happen. Generally more common in the lower extremities, but it can happen in the upper extremities too. Because again, our legs are working against gravity.
Lauren, we did have a question on that slide.
Yep.
The question is cording anywhere on the stages of lymphedema, or is that a separate thing?
Good question. Cording is a separate thing. It can be a precursor to lymphedema. It certainly can be. It is a separate thing. And for those who don't know, cording is when the lymphatic node, when the lymph node has been removed, the lymph vessel is still there. So the surgeon will pluck out the lymph node, but what it was connected to is still there. So that tends to get scar tissue, inflamed, and kind of get tangled up with the tissues around it. And an individual might actually see what looks like a piano wire in their armpit. And it can travel all the way down to past their elbow, all the way to their thumb. And it feels like a pulling. Good questions. Sorry, I like to look at everyone while I'm explaining things. So I'm going to flip back and forth if that's okay with everyone. Oops. So this is a nice visual depiction of those stages. And this is the one that I would show physicians all the time. Usually, I would get to see patients all the way over here where it says tape measure. But look at all of this other room on the left-hand side where we could be seeing individuals earlier on. Again, that ideal would be to get pre-surgery measurements of arms or legs, and then you have your procedure. And then you can see the progression. I hear a little echo, so if you could put yourself on mute, that would be great. You see that progression kind of increase. And then usually I get to see people over in the tape measure zone. So we want to ideally see individuals much earlier on so we can prevent progression as much as possible. So we'll move on to now, how is lymphedema treated? We call it, as lymphedema therapists, complete decongestive therapy, or CDT. So this involves 2 phases. The first is the active phase. So this is intensive, daily, or multiple appointments per week. It could include manual lymph drainage, compression bandaging, skincare, exercises, etc. This tends to be for those with moderate to severe swelling, maybe more immediately post an infection or an exacerbation of their swelling. And usually for those stages 2 to 3 in lymphedema, I should say 3. That's an error on my part. The maintenance phase is the other phase of treatment. Less frequent appointments, but continue to adhere to those self-care program, home management program, which includes self-manual lymph drainage, wearing of compression garments, paying close attention to skin care, exercises, stretches, as recommended by your lymphedema specialist. And this would be for those with minimal to mild swelling, or those that are in the prevention stage, stages 0 to 2. This is where I see a lot of my patients, maybe one time a month, one time every other month, one time a year for someone in a prevention stage would be an example of that. So it really does vary on what the individual needs pertaining to their lymphedema. Manual lymph drainage massage, you might hear it, or MLD, is mild superficial manual techniques, and it's really aimed at manually moving that lymph fluid from wherever it's getting stuck to another area of the body that can help absorb it and send that fluid along wherever it's supposed to go. Compression is either bandaging or compression garments. Lots of client education. It really is a partnership because I can't be with my clients 24/7. I'm with them 1 hour, 1 or 2 times a week, or one time a month. So a lot of work is done by the individual to do some things on their own and maybe get their caregiver involved as well. Skincare is so important to prevent infections, and then exercise. And we'll go a little more detail into each of these as well. So manual lymph drainage, it improves lymph production. It improves the lymph movement, improves lymph circulation. We're moving it along. It consists of special strokes to help break down any of the fibrotic tissue or tissue that has gotten a little bit hard because of that protein sitting there. And it also has a relaxation effect, and it helps relieve any kind of pain or pressure that someone is experiencing. I'm going to show you, I'm going to stop and show you. Okay, so this is my first time in Zoom doing this, so bear with me. But for example, with your arm, what you want to do, let's say this is my left arm. Let's say my left armpit is the armpit that had lymph nodes removed. So I'm going to try to move fluid to my right armpit that was not affected. So we're going to go across my chest, just like this, like you're sweeping across, like you're petting a cat or a dog. Okay. And then you do your upper arm all the way across. And then your lower arm all the way across. And so on. So we're starting here, we're kind of warming it up, we're priming it up. Think of it like, in order to get this swelling, this car backed out of the parking lot, I have to back out everything first, right? I can't just start here because there's nowhere for it to go. So I have to start here, back out these cars, and then back out these cars, and so on. And then your leg, I don't know if I can show my leg on the Zoom, might be a little challenging. Same kind of idea. So you'd start closer to your hip, back out those cars, and you could go up to your armpit if your armpits are not affected. That's what I tell people is usually the easiest. And then the top of your thigh, and then just below your knee, back out those cars, your lower leg, and your foot would be the last thing, all the way up to your armpit on that side. I know that's a really general, quick kind of explanation. and
Lauren,
Which is why I recommend seeing a lymphedema therapist.
Lauren, how many minutes should one do this and how many times a day?
Great question, Brenda. As much as you can, it's not going to hurt you. 2 minutes, 5 minutes is better than nothing. Ideally, if you could spend at least 15, 20 minutes doing it, then you'll get that analgesic effect, that pain relief effect too, that relaxation. And that's where your lymphatic system can really do its job, when you are relaxed. A great time to do this is before you go to bed.
Mhm.
Prime your lymphatic system, and then the lymphatic system can do its job while you're sleeping. But honestly, if you have 5 minutes, do it. I have ladies that are driving to work and they're at a stoplight and they're doing a little bit. Now, lower extremities are a little bit more challenging throughout the day, so you might have to set aside some time for your legs to do that. But I like to ideally, before bed, let your lymphatic system do its job.
Follow-up question real quick. How much pressure are we talking about? I would assume more pressure for the lower extremities than maybe upper, but I'm just curious.
No, not really. It's the same for upper and lower. It's seriously like you are petting a cat or a dog. Your lymphatic system is right there, your superficial one.
Okay.
The deep one, you won't hit with these kind of techniques, and that's okay. It's just enough to get your skin to stretch and move. So it's a little bit different than going to a massage therapist who is going through the lymphatic system to get at your muscles. So we're kind of massaging your skin. Mm-hmm. Yeah.
Okay, thank you.
The only thing that might happen is as you start doing this, you might pee more because it's moving that fluid along. So don't be alarmed if you have to go to the bathroom. That's actually a good thing. It's meaning your lymphatic system is doing its job. I have lots of clients who right after we get done, they're heading to the bathroom.
I am just wondering whether the beginning part, like if you are newly diagnosed, and having the problems, or those people who have had it for years, but like you says, it's no cure, and so they have to live with it, and they can. So would that be still effective to massage, like you have shown?
Great question. Yes, it is. It is definitely still effective. Now you may have to retrain your lymphatic system. You might have to try a different route, if you will. With traffic, think about that metaphor again. Let's say you figure out this way around this traffic jam and it's going great. Well, now all of a sudden, all of Omaha has figured out this route. And so it starts to get backed up again. Okay, let's figure out a different route. Let's reteach your body a different one. You can also try different strategies that we'll go into a little bit more to kind of jumpstart things again too, like the compression bandaging, a compression garment, maybe some exercises and stretches and things like that to kind of jumpstart your lymphatic system too. But yes, it is definitely effective. Consistency is the key, like with anything, and we humans tend to get lazy, right? We also tend to get frustrated too. I recommend you can even have a journal and write down some of your symptoms, and that way you can track, because maybe you don't see the difference, but maybe you're sleeping better. Maybe the tissue is a little bit softer. Maybe you're less achy. So keep track of those things too, to indicate that you're getting some improvement. Great questions.
Lauren, we have a question. We have a
Go ahead.
question here. Is there an order when doing lower part of the body? Example, top of legs, then bottom of legs?
Yes. So with the lower extremities, correct, you would want to do we call it proximal or closer to your hip first, and all the way up to your armpit, and then the top of the thigh, your knee, all the way up to your armpit, your leg, your calf. Yes. And then lastly would be your top of your foot and all the way up. Good questions. So another way we can manage lymphedema is with compression bandaging. So this helps with the efficiency of our muscle pumps. So if you think about it, if you are squeezing your muscles and it's pumping and moving, if you compress it down, the muscle doesn't have to go out as wide, if you will. It doesn't have to pump as far. So it's you're making it more efficient because it's providing some external support for those muscles. It also prevents a reaccumulation of that fluid you've just moved out of there. It helps break up scar tissue or that fibrotic, that tougher tissue in our arm and leg. And then during phase 1, the bandages ideally stay on until the next time you see the lymphedema therapist. So for example, when I'm doing compression bandaging, ideally I would like to see someone 3 times a week, like a Monday, Wednesday, Friday, do the MLD and bandage on a Monday. That person keeps it on until Wednesday when they come back. Most people do not enjoy compression bandaging. And here's a few pictures of those. So it's not the fun part of my job. People like the manual techniques, but not so much the compression garments and compression bandaging. So a compression garment is used kind of as the maintenance or prevention phase, whereas compression wrapping really would shrink down an arm or a leg, and then a compression garment, its purpose is to keep it there. There's all different kinds of varieties, different compression levels, day garments, night garments, and this is really when you need to work with a skilled lymphedema therapist in discussing the selection of the most appropriate garment for your situation, your lifestyle, etc. And then here's some examples of different kind of compression garments. I'm so thankful they're coming out with some stylish ones now. They did not have those when I first started.
Lauren, we had a question on the last slide.
Mm-hmm.
When you referred to a muscle pump, are you talking about the electric ones that are prescribed by a surgeon and sold through a vendor?
Good question. No, this is actually your muscle pumping. When you move it, like if I move my arm up and down, I can see my bicep contracting and moving. Good question. Thank you for clarifying that.
Do you know, Lauren, are those electric pumps covered by Medicare?
So the lymphedema pumps are not covered by Medicare. We'll talk a little bit about that in one of my very last slides. They are not covered by Medicare unless there is an open wound.
Okay.
Unfortunately. If you are interested in that, hook up with a lymphedema therapist who can talk to the representative from that particular company. You can try one out. There are some loopholes that you can go through. It's just kind of a process. But you definitely seek out some assistance from a lymphedema therapist in that process.
Well, she mentioned it to me during my last session.
Okay. Mm-hmm.
And
yeah, and the lymphedema pumps, it depends on who you talk to. And I will say human touch, a machine is never going to do the best as a human would. Think about a dishwasher. Yeah, it washes dishes pretty well. It's efficient, but it's still not going to be as good as us hand washing them. So just keep that in mind. But a lot of people use them. They're quick. They're fairly easy to manage. So yeah, make sure you're working with your lymphedema therapist and you try them out as well.
Okay, thank you.
Yeah, absolutely.
If I could interrupt just for a moment, Lauren,
Mhm.
for those folks that might financially qualify, also remember to go through the hospital foundation that is associated with where you got your treatment. For example, Methodist has a foundation and they have some funding to help patients with certain things like this, and it's called charitable care. So you can even just contact maybe the social workers at the hospitals where you're treated, and they can pre-qualify, see if you would qualify for some help that way. So
That's where I go, Jenny Ed.
yes, Tara Slevinson is the head of the foundation there, and wonderful young lady. I say young lady, she's younger than me. So, you know, you never know. Give them a call and see if maybe you might qualify for some help.
Yeah, and you can work with Mary Ellen Bartles over at Jenny Ed.
That's who I work with.
Yeah, she's awesome.
Yes,
Ask her
she
about these
is.
things too.
She's my lifeline.
Yeah, she's a fabulous human. So just a few other things to keep in mind. Sometimes we have swelling that isn't lymphedema. It could be possibly an infection or maybe heart related. Lymphedema therapists are very skilled at knowing the differences in these things. So if you have other swelling going on, you may be referred to a lymphedema therapist and they may check you out and say, no, this is not lymphedema. This is fill in the blank. So just wanted to throw that out there. So now on to our precautions and prevention. So what can I do to lower my chances of developing lymphedema? So here are the recommendations from a lymphedema therapist. If you can, limit those needle sticks and blood draws to your non-affected side. If both armpits are affected, see if there's another area of the body where they can draw blood, or you can get your vaccination, for example. The National Lymphedema Network is my accrediting body, and they recommend if you are getting a vaccination to get it in your opposite arm or your leg. You can get it into your leg. Blood pressure cuffs. Again, if you can, I would recommend not getting it on your affected side. If both arms are affected, see if you can do it in the ankle. Traveling, flying or driving. So flying, when you are flying, there's a different atmospheric pressure put on our tissues, our bodies. Most people will swell anyway on a longer flight, something more than generally the 3-hour-ish range. And that's okay for me. I don't have lymphedema. My lymphatic system is functioning. It can respond. It can accommodate that. For someone whose lymphatic system is already having a hard time, it could cause more issues. So you can wear a compression garment. You can do yourself massage with it. You can also, if you can, when you land, when you get to your destination, kind of relax a little bit if you can. Now, I know real life happens, and should you have a flare-up, then you see your lymphedema therapist and kind of calm things back down. Exercise is another area where I get lots of questions. With that, I recommend gradual progression of your exercise. Think about a marathon runner. I can't go out tomorrow and run a marathon unless I've been training, unless I've been building up that endurance for my body. The lymphatic system is the exact same way. You want to be able to build up its endurance, its tolerance of those activities you want to participate in. So work with your lymphedema therapist to figure out what that looks like and feels like. There's no set, don't go above 10 pounds or something like that. It really is person dependent. They used to say, don't weight lift, don't do so much weight, more than 10 pounds or something. And that's just not the case. Research has come out that says that exercise can be helpful if it's done in the right way for the person. And it is very individual on that end. So work with your therapist on that. Preventing infection. So infection and lymphedema are very related with that. We talk a little bit later about that. Self-monitoring, I cannot emphasize this enough. Check in with your body. How are you feeling? If you are an analytical person, you can take measurements if you'd like. Find a mole or a birthmark that won't move, and you could measure around it and keep track. But monitor yourself. How are you feeling? How are your clothes fitting? How's your jewelry fitting? And there has been some controversy on these things. And if you talk to some physicians, they may poo-poo it. Healthcare workers may poo-poo it. Oh, you had your breast cancer surgery 20 years ago. You don't need to worry about this anymore. And as a lymphedema therapist, I just have to disagree. Our lymphatic system, as I mentioned earlier, once that damage is done, the damage is done. The lymphatic nodes do not grow back. But I will say, I want you to live your life. I don't want you to be in fear either. So ideally, a member of the cancer treatment team or your lymphedema professional would discuss the lymphedema risk factors and risk reduction practices with you as the individual. What's going to work with you? What makes sense? So there is always medical necessity, and that may override the precautions in a life-saving situation. Yes, blood pressure, needle sticks, whatever they need to do, right? We can deal with the complications afterwards. The National Lymphedema Network has a position paper on this, and they say, quote, if possible, avoid punctures such as injections and blood draws, and if possible, avoid having blood pressure taken on the at-risk extremity, especially repetitive pumping. So again, if you can, we want you to continue taking those precautions as much as possible, because that's one of the ways you can lower your chances for developing lymphedema. And if you already have it, it'll lower your chances for making it worse. So that's my stance on that. Again, it might be different from other healthcare professionals, and ultimately, it's your body. Advocate for yourself. If something does not look good, does not feel right, get it assessed, talk about it, and say, no, I want you to take my blood pressure in this arm. What other options do I have, etc. I mean, I know it seems like you're making a fuss over it, but I would much rather have you reduce your chances if possible. And because when you think back to when I was explaining the anatomy and physiology of the lymphatic system, this is why we take those precautions. I brought up this chart again because, again, we treat every other injury. Knees, you hurt your ankle, we get in there and we start treating it, right? So I advocate for treating an injured lymphatic system the exact same way. As soon as that injury occurs, we want to treat it. Some warning signs, what to look out for. If you don't, obviously swelling, if you notice that, puffiness in that affected area. You could have generalized achiness, tingling, a heaviness, a sensation of heavy or fatigue in that affected limb. Clothes or jewelry might fit tighter. Pay attention to those things. And then from whom do I seek help? I'll get on my soapbox for this one, strongly recommend seeing a certified lymphedema therapist. So they will have CLT behind their name. Not all physical therapists, not all occupational therapists are certified. They may have some knowledge, but you really do need to see someone who this is all that they do. This is their passion. This is their knowledge base. Because as you can tell, I'm giving you an hours-long discussion in this, and there's quite a bit more that can be discussed. We could spend all day. So some risk factors for developing lymphedema. Really, anytime there's damage done to the lymph nodes or lymphatic system, you are now at risk. So that includes lymph nodes being removed. That includes radiation. Proportion of lymph nodes removed. So this question was asked earlier. This is an excellent question. The research right now says, yes, if you have a higher proportion of lymph nodes removed, you have a higher risk of developing lymphedema. Not guaranteed, not 100% for sure it's going to happen, but it's a higher risk. So earlier I said we had around 15 to 20 lymph nodes. And if I have a sentinel lymph node biopsy taken away, that's 1 of 20. And then let's say I only have 8 lymph nodes to begin with, and I have that 1 taken away. Well, that's a higher proportion, right? So that's how that works. Hopefully I answered that question. Your health status prior to your surgery, procedure, or treatment. Those who are obese or overweight tend to have a higher incidence of lymphedema because your lymphatic system is already working a little bit harder than it was designed for. Your safety valve, if you will, is a little bit smaller.
Lauren, I'm going to interrupt you because I have a few questions in the queue that I want to make sure that we get to. So I apologize for the interruption.
No, you're good.
One of our participants asked if lymphedema has an adverse effect on neuropathy.
Ooh. Okay, so that there is a relationship between the two, for sure. In terms of lymphedema, you can have decreases in sensations. You might feel some numbness, some tingling, depending on where that surgery occurred. You know, if it was in your armpit, for example, it may be numb in areas. So there is a relationship for it, but not necessarily a direct causal relationship. So they kind of play off each other, but not a direct causal. Okay, does that make sense?
Yeah, thank you, Lauren.
Mm-hmm.
And then we had somebody else to go back on your suggesting a lymphedema therapist. So if somebody has had nodes taken out and they've completed chemo and radiation, do you recommend that they seek out a lymphedema therapist or ask their oncologist to suggest one? What do you recommend in that?
Good question. So there's a few different ways you can do that. One, yes, absolutely. Talk to your oncologist, your nurse navigator, part of your cancer team. Usually they have a very good idea of individuals in the area whom they trust. If you have friends or family that have gone through and seen someone, maybe they had a good experience with someone, you can look online as well. National Lymphedema Network has registered lymphedema therapists in areas as well. So you can type in your area and find those. And then LANA, LANA.org, Lymphatics Association of North America, also has a listing of certified lymphedema therapists, LANA.org. So
And
it's different ways.
And Michelle says that she recommends you.
Well, thanks, Michelle. I appreciate that.
The last question, go ahead,
Oh.
Brenda.
Oh, I was just going to jump in and ask a couple personal questions for me, but relating back to the travel.
Yes.
So I don't have lymphedema. However, I got alarmed when you told me about the average number of lymph nodes because they took 19 out of my arm.
Right, right.
And I feel like, wow, I might be really bumping up against that ceiling that you talk about and didn't really realize it. So because I don't have it, should I, on a long trip, should I, it's been, I will be 5 years from diagnosis this fall.
Okay.
Even though I'm 5 years out, should I really be thinking about for a long flight, doing a compression garment on my arm, for example? Should I be thinking about not carrying my big, gigantic purse on my right arm?
Right.
I am doing the other things. I don't allow blood pressure over there. And I made them do my COVID shot both times in my left arm, all those things. But I just wondered about that for those of us that are trying to work on prevention.
Great question. And my stance is that it's never going to hurt to see a lymphedema therapist, talk about these things, your individual case. And if you are flying a long ways, how long has it been since you've flown? Is your lymphatic system built up that tolerance or something like that? So have that conversation with a lymphedema therapist. Maybe measurements are a good idea. Maybe starting in doing some preventative self manual of drainage is a good idea. The compression garment, even if you don't necessarily wear it every day, you could have it with you and throw it on, during the flight or when you land. If you feel puffiness or something like that, it's a little bit difficult to diagnose and provide assessments right off the bat, but I would say it's never going to hurt to have that conversation with someone. And even, like I said, I have several people that I see once a year, check in, measure, how's it been going? And in that instance, we have caught things early. We have said, oh yeah, I did notice your measurements are slightly higher. What have you been doing? And then you can have that conversation. So Brenda, that's what I would advise. I know that's not right on exactly telling you what to do, but there's also some personal accountability to these things too. I like to give people as much information and empower you to make the choice that's right for you. It won't hurt to start doing some of these things whenever, if you can, before your long flight is coming up. Yeah.
Thank you.
And then
we're gonna finish the slides and finish any questions. And so if you guys have any last minute questions, feel free to submit them in the chat box. I know we're right up on time now, so if you guys have to go, that's no problem. But for those that are able to stay on, we'll continue to finish up the slides here.
Awesome. Thank you, Kelly. Great questions, great conversation. Awesome so far. So lastly on this slide, infection. So cellulitis is a bacterial infection of the skin, and there is a relationship between cellulitis and lymphedema onset. Cellulitis can be the first sign of lymphedema. It can make lymphedema worse, or it can create kind of this cycle. So you've got, and it is sometimes that chicken and the egg argument. I want you to take it seriously with the infection piece. We can deal with swelling. We can manage that. Swelling itself is not life-threatening. Cellulitis can be. I have one particular patient who has had, I don't know how many infections now. It's just poor woman, and can go septic, so that infection spreads throughout their body very quickly. So that's something to really pay attention to. Signs of infection would be the area is red or pink. It's hotter to the touch or more warm than other areas of the body. You might feel feverish. Those are the things to look out for an infection.
We had somebody ask, how can you tell the difference between lymphedema and normal swelling?
Great question. Great question. So lymphedema tends to be a thicker swelling, if you will, because of that protein that's getting stuck. Your fluid is not, your body is not able to move that lymph fluid versus, let's say you sprained your ankle and it's just kind of puffy and watery. So it's a thicker. It also may feel heavier than an injurious type swelling as well. Other ways to see what the difference is again, I mentioned earlier, if it goes away at nighttime or with elevation versus if it doesn't, is another way to tell. Sometimes, honestly, it is difficult to tell. The good thing is, regardless of how you get the swelling, these things that I'm telling you about, the compression garments, the manual lymph drainage, elevation, all of those things will help. It will help all forms of swelling, but particularly the manual techniques help with the lymphedema. And then some people really just, you need to see it and feel it too. So just a couple of slides here. We touched on a few of these things. Lymphedema is pervasive. It can have an impact on all of the activities that we need to do, want to do, and have to do. Self-care stuff, so your basic everyday activities can be a challenge with dexterity, range of motion issues, leisure participation. We talked about exercise and weightlifting, how it can affect that. I had a patient whose doctor told them, I don't want you holding your grandbaby. And I said, haha, no, we're going to figure this out, because my goal is to have individuals participate in those activities that they truly love and find meaningful. So let's figure out how to do so, not just you can't do it. Returning to work, some people have issues with computer work, keyboarding, repetitive type activities with exacerbation. So maybe a compression garment, a compression glove might help with that. Work with your lymphedema therapist to figure out modifications that might help mitigate some of those symptoms and side effects. And then lastly, that there is a significant impact on psychosocial. Here you've beaten cancer, you've gotten through those tough treatments and surgery, and now your hair's grown back or your eyebrows are filling in, you have eyelashes now, and here you've got this constant reminder of the cancer with lymphedema. There's a higher incidence of those with lymphedema that report depression and anxiety that affect their everyday. Maybe they isolate themselves because they don't want to go out wearing a sleeve. Maybe they hide that arm or their leg. In the warmer weather, it's not the most fun to wear a compression garment on your leg and have people ask you over and over, what happened? Did you burn yourself? So there is that impact on that side of it as well. And again, I would highly recommend talking with your occupational therapist or lymphedema therapist about addressing some of those needs as well. I mentioned earlier coverage for some of these items. part of my role is to advocate for my clients. And one way I do so is by trying to increase the access to medically necessary lymphedema treatment and supplies, and making that as equitable as possible. So if you're interested, you can look at the lymphedema-treatment-act.org, and it's trying to rename some of our compression garments and treatment and supplies as medically necessary. Currently, the government does not deem those things medically necessary, which we all know they are very much necessary. And so we want to work on that. So Medicare will cover a lot of these things too. So I just thought I'd throw that out there. And then let's open it up now to questions. And again, if you have to hop off, go right ahead, email me, Lauren Robbins 2005, that's 1B at yahoo.com. Feel free, reach out and we can chat offline as well. So with that, let's answer some questions. I know we're running over time, and that's perfectly fine with me. I'm okay if you all are okay.
Thanks, Lauren. That was really, really helpful. And you're getting a lot of love in the chat box. People are saying thank you, and it's been very helpful. You touched on this question a little bit, but perhaps you could just give a quick summary of that. The question states, will the lymphatic system stabilize post-injury to the system?
Great question. The lymphatic system does heal a bit in that any part of the body, let's say after your surgery, your wound heals, your incision heals, right? But that part of the body is never the same afterwards. So let's say I have surgery, my tissues right now beforehand are intact, they are close together, they are as they were. I have surgery that's busted open, and now they grow back together with scar tissue. So they get close, but they're not how they were before, right? So your lymphatic system is the same way. It can heal to a certain point. It won't be that 100% that it was before. Lymph nodes do not grow back. I know I mentioned that as well. And that's why we have to find these alternate routes around that road construction. So yeah, you can heal some, and part of that healing is with the treatment itself, with the manual lymph drainage massage treatments, with the working with your lymphedema therapist to develop an exercise program, like being healthy in all aspects that you can, nutrition, water intake, etc.
I am wondering, there is so much information you gave, and it's just so valuable, and then I'm just wondering whether or not there is any way that we can get a copy of your presentation. Is it possible?
Yeah, I'm okay with including slides, and I know this was recorded as well.
Yeah, yep. We'll go ahead and send out a post-event email at the beginning of the week with some of the resources that Lauren mentioned. So thank you very much for that question. Again, we're just getting a lot of good feedback in the chat box. So thank you, Lauren. Any last minute questions before we close up? Thank you guys for hanging out a little bit longer. Anybody else have any final thoughts or questions?
Sorry, but you did show us how to do that, how to exercise with the manual thing, Could you do that one more time?
Sure, absolutely. For example, if my left armpit is where the lymph nodes were removed, or I had radiation on my left chest, I want to try to utilize my right armpit, because here, let me move my camera down. There we go. How about that? Is that a little better? I want to utilize my healthy armpit, my right armpit, to help absorb that fluid and send it on where it's supposed to go. So I like to use the cars in the parking lot analogy. So to get these cars backed out of the parking lot, everything else needs to be backed out first. So we actually start over here going towards our right armpit. And it's just like this on yourself. I don't expect you to know the very specific manual techniques that a lymphedema therapist would do on you. It's just like petting a cat or a dog. Across. And then we're going to go kind of around your left armpit and across. And then you do your upper arm and across. Your lower arm. And if you can see, I'm doing it just enough, get close, where I'm just having that skin stretch, just like you're petting a cat or a dog, all the way across. And then lastly, your hand, all the way up. And again, 5 minutes is better than no minutes. Ideally, 15, 20 minutes. So you can get your lymphatic system engaged, relaxed, would be the ideal. If you can do it before bedtime, to really prime your lymphatic system, that would be great. Is that helpful?
Yes, thank you so much.
Thanks, Lauren. With that, we are going to close up. If there were any questions that we missed, we'll go ahead and send that out in a follow-up email as well. So just a couple closing notes. Thank you again, Lauren. This has been very helpful. We did record this event, so we'll have that recording available if you want to watch again, if you missed something in there as well. We do have these events monthly, and so if you have any topics that you'd like to see covered, please let us know. Our next one, we're having Lauren back on Saturday, May 8th, and she's going to talk about simple exercise and nutrition. So you guys are welcome. Registration is live on our website for that, so feel free to check that out. The only other update that I had for you guys is that we do have Survivorship 101 classes starting each month. So we have spots available in our upcoming May and June classes.
I just wanted to add real quick, thank you, all of you, for coming today. And thanks to those of you who were able to make a small donation to us. We really, really appreciate it. It really helps us keep all of our programs and services free for everyone, because we know lots of you folks are struggling with the bills that come along with being a cancer survivor. So thank all of you so much. And again, please feel free to take advantage of the link. Please come back in a few weeks to hear Lauren speak again. And you can go to our website, atimetohealfoundation.org. That's where you will find more information on our survivorship classes. You can actually sign up from there, on our brain fog classes, and our next Create Your Best Life event. So our website is everything you need to know, okay? Thanks, everyone. Have a wonderful, wonderful weekend and Saturday.
Thank you.
Thank you.
Bye, everyone.
Bye.
Bye-bye. Thank you.
Thank you, Lauren.
Really excellent. Thank you. Bye-bye.
Yes. Excellent.